Greetings. I am Dr. Shenetha Ramsey with Gifted to Inspire LLC. I hope you are doing well today. I hope you're having a blessed day. I know each day is always a good day. It's always a blessing to be able to see each day and plus just feel comfortable in your skin and just feeling well, not feeling down, not feeling sad, not feeling all the stuff that's been going on. It's a lot been going on, I must say. But I'm just gonna say this here to encourage you to keep pressing on. Don't stop. Don't stop. Don't stop doing what you're doing. Sometimes it seems like it could be a struggle. Sometimes it seems like it could be hard. Don't you stop doing what you're doing. You do what you are called to do. Tonight I'm going to share with you. I'm going to have a talk seminar. Well, I'm gonna say seminar. I should say awareness talk. I should say awareness talk. This awareness talk is pertaining to awareness talk pertaining to depression among college students. And this can also mean depression among youth too, but I'm primarily homing in on talking about depression among college students. I know young people may experience it too, but it may be different ways, but it still can be used. This message, this information can be used for anyone that may be going through some type of situation may be causing sadness or anything that could be causing a hindrance for you or something that could be just pressing on you to keep you thinking that you're not going to be successful when you really are going to be successful. Just keep trying, don't give up. Awareness talk, college students and depression. I'm going to share with you briefly. The purpose of this talk, this seminar talk, is to bring awareness. I'm bringing awareness because depression affects a lot of people. Many people may not believe it, but a lot of people are having some serious situations. They may not be talking about it, but they are experiencing a lot of different situations. For example, they may be experiencing a relationship problem. It could be something with their parents they may be struggling with. I'm just giving some examples. Not saying it's you, but some people may be struggling with unemployment. They could be struggling with possible grade situation. It depends on what it may be. It could be a number of factors. But many people, I know many college students right now, they need to hear this because I know everything is changing. Pandemic has changed a lot of things for a lot of people, and everybody has a different background, different environment, different upbringing. I'm saying that because this is true. Different situation. Everybody deal with things differently. Everybody don't deal with things the same way. So I'm having this seminar talk or this not seminar talk. I keep saying seminar talk. Excuse me for saying that. I'm having this awareness talk right now because this is important, not just for me to share with you, but I want to make sure that many people understand that depression is not something like a lot of people going through that and then they may not even know they have it. So just make sure that you be aware that if you have family and friends or if you have someone you may know that may not be themselves or may not be talking as they should be talking or they have a change in their mood or they may not be around you like they usually have been around you. Just different things, just different factors that could be a sign of something's going on with them. So just make sure you stay tuned into your friends, family, loved ones, whoever it may be that may be going through. But the purpose of this awareness talk is to bring awareness. I'm going to go over a few keywords with you. Depression. Depression is defined as being pressed down, feeling pressed down. It's a Latin verb which is also called deprimer. According to the DSM-5 2013 text, the DSM-5 is called the Diagnostic and Statistical Manual of Mental Disorders that provides thorough information as it is about the various mental disorders such as depression and other types of disorders, but specifically depression I'm talking about tonight. This particular text, DSM-5, is used by mental health professionals and clinicians to properly diagnose patients or diagnose a person that may need this type of help with, or maybe not saying they are depressed, but to make sure that they are being treated according to what they may have. Psychotherapy. This is defined as specialized formal interaction between a professional, healthcare professional in that profession, and a client. And this is important to notice because a person may not know this, and it's very important to be aware because you never know. A friend may need it, or somebody close to you may need this type of assistance. So it's best to always be aware of how to help that person if they may be going through a situation like many people are going through right now. According to Barker 2014, helping solve symptoms such as depression, stress, because stress is also a part of depression. It causes out depression in people. Relationship problems I mentioned before, difficulty in coping with social environment. These are some parts, some elements that can cause a person to not feel as they are able to move forward or do things as they would like to do. Intervention includes treatment and other activities that solve or prevent problems or achieve goals, according to Barker 2014. But these are a few keywords I wanted to bring up. Like I just mentioned, depression, DSM-5, psychotherapy, and intervention. And coping and relapse. Coping is defined, according to Barker 2014, is effective behavior an individual uses in responding to or avoiding sources of stress. Typical coping skills include obtaining new, needed information, pre planning, maintaining control over one's emotions and impulses, delaying gratification, and seeking more appropriate alternative ways to achieve goals. Relapse is the recurrence of symptoms, according to Barker 2014. And that's true because many people may experience that. Relapse is not something to take lightly. Many people experience that. They may not talk about that, but they do. That's why it's a person that may, not saying everybody is going through that, but a lot of people, according to what I've read, especially the college students, they go through a lot of transition, a lot of changes. Many of them may deal with the relationship situation. It could be many factors. Give us some examples. It may be dealing with stress, high stress. They may be trying to work, go to school at the same time. Or it could be a number of other factors. They may have children. That could be a lot of stress. Not saying children are stressful. I'm saying it's okay to have children. But I'm saying that when a person has a whole lot to do, a college student has a lot on their plate. A lot of people may not understand that. A college student goes through a lot of changes, especially when they first just getting into school. They go through a lot. They got to deal with coping, adjustment, all that goes a long way. Now, everybody deal with things differently, but I'm saying this to help the college students out here going through this pandemic and post-pandemic as well. How to understand that they're not alone. They can get the help they need. If they need help, don't be afraid to ask for help. Just keep in mind that you can overcome the stress. You can overcome that. You can overcome that. Define depression. Depression defined. Depression is a clinical depressive disorder, and it's also known as a major depressive disorder. There are multiple symptoms that fit depressive disorder, but I am describing the common depression that may relate to many after the age of 18. I'm saying that because college students are pretty much after the age of 18, 18 or older. Depends on how your birthday run. Maybe it could be, I'm not going to say 17, but your birthday, everybody have different age bracket. Birthday might run differently. But I'm saying this here, 18 and older. That's when that can happen to college students. And they don't be careful of how to manage their health, take care of themselves, and being aware of their workload. Depression and anxiety have become increasingly prevalent in today's college students, with many stating these mental health issues are their biggest barriers to doing well in school. And this is according to Affordable Colleges Online 2019. According to Segal Williams and Teasdale 2013, depression is a mood disorder that negatively impacts one's ability to think clearly, It frequently changes the individual's sleeping and eating habits. According to Garber, Ciesa, Macaulay, and Diamond 2011, they found that depression is considered the common cold of mental illness in adults and causes problems for families as it relates to the child, parent-child relationship, and increase in the use of medical and mental health services. So I'm saying this to you. This is statistic. This is information that I have research, that I have information on. The citation I just gave you are valid. What I'm saying, they're not made up. These are real citations I just said to you. So if you want to check into them, you're welcome to check or email me. But like I'm saying to you, it's important to stay tuned into your mental health. College students, high school students too, but I know I'm talking about college students right now. If anybody that's looking at this, watching me right now and listening to what I'm saying, whether they're college students or whether you're younger than college students, take care of yourself. Take care of yourself, because one thing about it, if you don't take care of your mental health, that's not good. Depression doesn't have no discrimination. Many people think because they do this or they may have this, that's a lot to deal with. When you know your schedule is overwhelming, if you know something is overwhelming and it's causing you not to be yourself, or it's causing you to be stressed out or something like that, I'm trying to say, make sure you tune into yourself. Don't ignore the fact, because that could be a problem not just for yourself. That could be a problem for people around you. That could be a lot to deal with. And I'm the type of person, I don't believe in pointing fingers at nobody, but I'm saying this here is important to take care of yourself. And we all human, we all have to live. But it's important to make sure you take care of yourself. And it doesn't matter what will tell you about, oh, I wouldn't do that, I wouldn't do that. If you know it's something too much for you, don't do it. Do not do it, because you have to live with the choices you make. And they cannot judge you for the choice you make. If you know something is too much for you, I'm giving an example. If you know your work schedule is too much for you, if you can't reduce those hours, well, you might need to find something else. I'm just being honest. I'm telling the truth. Just find something else. Don't feel bad about it, because a lot of people, they look at it like, well, she didn't have this or she didn't do this. Well, maybe she don't want to. It's not, or maybe he didn't want to do it. It doesn't. No, that's not the truth. Because some people may not be able to. Not saying they can't do the work or to deal with the task. They may believe, they may feel like, well, it's too much, and it may be too much. A person know how much they can bear, how much they can take on. There's nothing wrong with reducing your workload or reducing your modifying your calendar or changing your schedule. Nothing wrong with that. So don't feel bad about it, and don't feel guilty about it, and don't feel bad about it. Don't do that. I'm gonna be brief on this part here. History of depression. History of depression. Dr. John Cade was an Australian psychiatrist who first identified depression, according to Australian Dictionary of Biography, 1993. In the book Mending the Mind, 1979, Cade described depression as the most painful illness known to man, equalizing or exceeding even the most exquisite physical agony. Although Cade did not have a specific name for depression, he believed that depression was caused by a strong despair. And by me saying this to you, by me sharing this with you, despair is a serious situation too. That could be a major problem for a lot of people. A lot of people may be going through despair. I mean, and in case you know, despair is like a sadness. It's a sadness, and it's not something that will go over overnight. I can't really say how a person deal with it, because everybody have different situations how they deal with things. But despair is not something to ignore. A person been feeling that way for a while, is for sure longer than so many days, so many weeks. Yes, it should not be ignored. According to Mitchell and Hansey 2000, Cade describes symptoms of depression as the experience of fear and despondency. As I said before, do not ignore your situation, your symptoms. If you're feeling sad, if you stay in the bed alone and you just stay in the bed, or something happened and you really, really need to talk about it, just talk about it. And when you talk about it with somebody that's going to understand you and not judge you, make you feel bad about it. You talk to somebody that's going to listen to what you have to say. They're not going to talk about you and judge you. because many people, especially college students, they have a lot of things on their plate. Especially when they just starting off in college, they have a lot on their plate, and they don't need nobody telling them what they cannot do and what they shouldn't be doing. Because first of all, I know college students are adults. We know college students are adults, but at the same time, they need people to help them too. Depression is a serious situation. I'm not saying that you have depression, but I'm saying a person that may be dealing with sadness for so many weeks and days and weeks, there could be possibility there are possibly. But a person know they have a lot on their schedule. It best to prevent this from happening, a college student to prevent this from happening, is to make sure you know your schedule. Take care of yourself. And don't put too much on yourself. Don't let nobody tell you to do this too much. If you know you got too much on yourself, don't do it. Just don't do it. And politely say don't do it. And when you say it, be honest about it. Don't have to tell them, if you have to tell them if it's a lot for you. It's okay. There's nothing wrong with it. Because we are all human. It's okay. Don't feel bad about it. I want to share with you also. I'm going to share with you briefly too that you are valuable. Don't make nobody make you feel that you're less than a person or make you feel bad because you may have some things going on in your life. Because nobody knows what tomorrow holds. Nobody knows. All we know what we have right now, and we be thankful for what you have. Be grateful for what you have. All I'm saying this in so many words that you are a college student. Your students, you are in school to get your education, learn all you can learn, and you want to make sure you experience your college, have a good college experience. I'm saying, you want to enjoy yourself while you in school. You want to enjoy yourself. You don't want to look back and say, "Oh, I should this, I should did that." You don't want to do that. I'm saying this is best to always enjoy your day while you there. Enjoy yourself. Do what you can do. I know the pandemic has changed a lot. It has changed a lot of things. But at the same time, you still can progress. You still can do things. Don't feel like that you by yourself. If you need to talk to somebody, talk to somebody. And I'm saying that because it's a lot. Talk to somebody that's going to listen and help you. That's going to give you the right information too. That's important. And I want to also one more thing I want to share before I close this. Don't ignore your signs and symptoms. I know I said that earlier about the signs and symptoms. I'm going to say this again. Do not ignore it. And I'm going to go over the signs and symptoms with you briefly. Depression may sometimes be undiagnosed or misdiagnosed in some older adults because sadness is not their main symptom. May have other less obvious symptoms of depression, or they may not be willing to talk about their feelings. It is important to know the signs and seek help if you are concerned. Depression has many symptoms, including physical ones. If you have been experiencing several of the following symptoms for at least 2 weeks, you may be suffering from depression. And these are what I'm going to tell you now: persistent sad, anxious, or empty mood, loss of interest or pleasure in habits and activities, feelings of hopelessness, pessimism. And when I mean by pessimism, that means you talking sad. You put a person. The person is talking not positive. It's not nothing positive coming out of their mouth. They're saying things down themselves, or talking negative words, having negative words. Feeling of guilt, worthlessness, helplessness, decreased energy, feeling down, slowed down. These are some of the symptoms of depression. Signs and symptoms of depression. The difficulty concentrating, remembering, making decisions. Difficulty sleeping, early morning awakening or oversleeping. Appetite and or unintended weight changes. Thoughts of death or suicide attempts. Restlessness, irritability. Aches or pains, headaches, cramps, or digestive problems without a clear physical cause and or that do not ease even with treatment. So these are some of the signs and symptoms, and I want to share that. I'm sharing that with you now because that's very, very important. Because many college students need to hear this, and I hope this is helping you because I'm. This is a concern, a major concern, because many people have friends, families, or loved ones and do not know what to do to help the person. Do not know what to do. They need to hear how to help the person. Just it's very important to communicate, and it's very important to speak positive things to one another. Very, very important. I'm going to give you this. I'm going to share with you some sites that you may want to check into for more information. I have 3 citations. The first citation is Center for Disease Control, CDC, and you can go to their website, coronavirus.gov. My second link I'm going to share with you is the National Institute of Health, which is nih.gov/coronavirus. The third link, National Institute of Mental Health. And this link is nih.gov/COVID-19. These 3 links should give you some information. I know there's a pandemic going on, but these 3 links are the get the latest, stay in the know. These some links that help you, a person that may be going through this or may think they may be going through it or may know somebody else that may be going through it. So it's best to always stay communicating with one another. Stay in communication with your friends, family, or whoever your loved one may be. Don't ignore when they're telling you things that's not their normal self, or they may be saying stuff, or they may be even their appearance could the signs and symptoms. Their appearance, the things they're saying, or their mood. Those are the things you have to look for. I hope this has helped you. I hope this awareness talk has helped you tonight. And I am so glad that you tuned in and you listened to what I shared with you concerning college students and depression. This is very, very important. I would like to tell you this here. Stay encouraged. Do not stop your education. Stay in school. You learn what you have to learn. Get what you went to school to get. And stay encouraged and do the best you can do. If you want to set up a consultation with me, email me at giftedtoinspirelet'see@yahoo.com, or go to my website, giftedtoinspirelet'see.com, and accept your consultation. I am a certified life coach and an evidence-based coach, and you can accept your consultation with me, and I'll be glad to help you if I can help you. I aim to help you. If what you need from me, I can help you with, I'm going to help you much as I can. I look forward to hearing from you. Thank you for listening. Take care of yourself. Be well.